One of the things that I'm frequently having conversations with other healthcare professionals about is the clarity of their offerings. Too often, they are using either medical jargon or what I would call more internal speak when communicating with people externally or their potential clients who are trying to determine whether or not you, the individual, is the person that they need to reach out to for services. So, what do I mean by this? There is a difference between internal speak and external speak. What myself and other healthcare professionals may use to communicate what it is that we're doing and what it is that we're offering, I would argue should be significantly different than what we would communicate to somebody who, say, is the lay person, who doesn't have the level of medical and healthcare knowledge that we do. So there's an internal voice and external voice, and too often I will see that internal voice communicated through things such as a website or social media. While it may seem that you have a certain amount of intelligence, it actually is confusing people and very challenging for them to understand what exactly that they are choosing or potentially choosing from a services or a product standpoint. My recommendation to you is to think like your family member or your friend who does not have significant medical knowledge. What are terms that they're familiar with? What are ways that they use to describe what it is that they're looking for when trying to find a service or product? So sometimes getting outside of your head as the practitioner or the professional and putting yourself in the psychology of the person that you're looking to serve, this is a great way for you, first and foremost, to clarify your offerings so that things like website, social media, and maybe even some of your in-person speaking are more effective.